Usually behavioral interventions are initiated in the school setting for school-age children, obviously, because that's where many children display problem behavior. And many schools have behavior resource specialists that might initiate a treatment in that context. The thinking on behavioral interventions is that they need to match the level of severity of problem behavior in terms of how disruptive it is and, again, how severe it is. So first-line behavioral interventions are more passive interventions altering the environment. Might include focus on skill building, teaching communication skills, choice making, that sort of thing. And then higher level interventions would involve doing a more formal behavioral assessment to understand what are the variables in the environment that might be occasioning behavior and the behavior of others that might inadvertently reinforce behavior. One of the things we see with functional behavioral assessment findings, both in literature and our own experience, is that the more common things that inadvertently reinforce children's behavior are getting access to attention from adults, which usually takes the form of an adult trying to console or calm a child, access to preferred activities, or escape from work. Escape from work is a very common problem where teachers might inadvertently reinforce problem behavior by giving the child a break when he starts to engage in problem behavior. So even though that makes sense from his teacher's standpoint, and the teacher's trying to not create a situation where the child is upset during work situations, it can also set the stage for a child to learn that problem behavior produces escape. And then more intensive interventions can be developed that might involve lots of reinforcement programming where the child learns that certain behaviors that we want to increase produce access to preferred items and reinforcers. The interventions might involve, if the behavior is severe and dangerous, it might involve procedures for physically helping manage the child so that he doesn't hurt himself. So there's a whole range of procedures that are out there that really have been developed over the last 30 or 40 years. So there are lots of interventions out there.